Good afternoon, everyone, and welcome to Community Conversations, supporting the Latinx community during COVID-19. Please welcome the community engagement team from the American Red Cross Los Angeles region, Kendall Dunlap-Korsness and Patty Madera.
Hi, everybody, and thank you, Mimi. Thank you for being here today. I'm Kendall Dunlap-Korsness, and I am the Acting Director of Community and Faith-Based Programs at the American Red Cross Los Angeles region. I'll be co-hosting today with my colleague, Patty Madera. So we're very grateful for your time today. We know it's a busy time for everybody, especially now. We just are so grateful to spend this time with you. We hope that you and your community are safe and well and healthy. And today's community conversation is about supporting the Latinx community during COVID-19. The community conversations hosted by the community engagement team at Red Cross LA was a response to COVID-19 when we couldn't host or go out to events anymore. But the intent is still the same, to provide a discussion and highlight resources within and outside the American Red Cross so our communities remain connected and resilient. We hope to serve community and faith leaders, even from afar, so you can continue to serve your communities. Today's topic, supporting the Latinx community during COVID-19, is timely because tomorrow marks the end of National Hispanic Heritage Month. We'll hear from a fantastic panel who will speak on how the Latinx community in LA and beyond has been particularly affected by COVID-19. They'll share their expertise and their organizational resources with you all today. If you have any questions, you can use the Q&A function. It's in the chat bar down below. So if you hover your mouse, a bar will come up. Let's say Q&A, and we'll moderate those questions at the end to all panelists. Additionally, all resources discussed today will be shared in the chat bar, and it'll also go out in a follow-up email after this event, along with a recording video of the event. So first, I'm going to introduce our panelists. We have a really great panel set up today. First, we'll hear from Dr. Rodrigo Dominguez Villegas, the Director of Research at UCLA Latino Politics and Policy Initiative. Dr. Villegas serves as LPPI's Director of Research. He's responsible for developing, managing, and executing LPPI's research portfolios, as well as mentoring LPPI's policy fellows. Previously, Dr. Villegas worked at the Institute for Social Science Research at the University of Massachusetts Amherst, where he provided consultations on research design and statistical methods to scholars across various disciplines. He was also a research consultant for the Migration Policy Institute in Washington, D.C. He conducted research projects on international migration in North and Central America, return migration, and Mexico's migration policy. Next, we'll hear from Yesenia Madera and Elizabeth Sanchez, licensed marriage and family therapists at Inner Soul Counseling. Yesenia is a licensed marriage and family therapist. She has a master's in marriage and family therapy from Pacific Oak College. Yesenia has experience working with a broad range of issues, such as working with those who are experiencing trouble in their relationships and families, adult survivors of abuse, emotionally disturbed adolescents, and those who are suffering from depression and anxiety. Above all, she values empathetic attunement and seeks to provide a safe, caring, non-judgmental place for healing and growth. Yesenia is bilingual in English and Spanish and provides a culturally sensitive environment. Elizabeth is also a licensed marriage and family therapist. Elizabeth has had experience in working with children, adolescents, adults, families, couples, and geriatrics from diverse backgrounds. Elizabeth is also fluent in Spanish and English, which has allowed her to provide Spanish-speaking services to the Spanish-speaking community. Elizabeth's goal as a therapist is to provide a safe space where clients feel validated and supported while learning new ways of viewing life, finding their inner strength, and coping with their current struggles. Third, we'll hear from Lucia Torres, MPA, Executive Director at Los Fotos Project. Lucia was born and raised in the San Fernando Valley, where she began her community organizing and advocacy when she was a student at Pacoima Junior High School. She received her BA in Chicano Studies from UCLA and went on to receive her Master's in Public Administration from CSUN. For nearly 20 years, she has dedicated herself to supporting young people through education, grassroots organizing, and building youth development programs in the communities of Sylmar, Pacoima, Boyle Heights, and South Central Los Angeles. Lucia is also a freelance writer and has a background in media and communications. She's used these skills to support emerging nonprofits with creating communications, marketing, and development strategies that have increased their impact and reach. Last, we'll hear from Luis L. Resendiz, Program Director at CIELO, Comunidades, Indígenas, and liderazgo. Luis is currently CIELO's Indigenous Interpreter Program Director. He is presently the State Coordinator of Frente Indígena de Organizaciones Binacionales in California, where he is in charge of taking the struggle for the respect of the rights of Indigenous peoples to spaces where Indigenous peoples are not represented and to make visible their migration to the United States. Mr. Lopez Resendiz is a graduate from the University of California, Berkeley, with a BA in the Department of Interdisciplinary Studies. He's a poet whose work has been presented at the Center for Race and Gender at UC Berkeley. He's also been featured in La Jornada, La Trinchera, the Los Angeles Times, the New York Times, and El Excelsior. Currently, he is a host on To Un Dali podcast, a podcast for and by Indigenous people. Then last but not least, we'll hear from Patty Madera, our co-host and my colleague, who's the Community Outreach Senior Specialist at Red Cross LA. She'll talk about her work on the Latino engagement team. She just returned from 2 back-to-back disaster deployments in Northern California and my home state of Oregon in response to the wildfires. We're very happy to have her back and talk about her experience and about the Latino engagement team in general and how to get involved. So we have a wonderful panel. I want to jump right in, so give them as much time as possible. I'm going to hand it over to Patty before we hand it over to Dr. Villegas. Thank you all for being here again.
Thank you, Kendall, and thank you to all of our panelists. We're really excited about this community conversation. It's very special. And so we'll go ahead and get started. And I'll go ahead and pass it over to Rodrigo.
Thank you so much. And thank you very much for the invitation. And thanks for everyone who is attending and who's listening to us. So let me share with you some things I'll share with all of you. Can you see it well? Great. So I want to give you all some context on the ways in which the pandemic has impacted Latinx communities from a very broad perspective. As many as you know, Latinos and other communities of color have been disproportionately affected by this pandemic. And this is not news. We've seen it all over. But what is really important to understand is why is it that Latinos have been so disproportionately affected? At the Latino Policy and Politics Initiative, we've been conducting multiple studies to understand the underlying mechanisms that are making our community more vulnerable to the pandemic in both its health and economic effects. As I'll show in the following slides, the pandemic has either uncovered or highlighted existing structural inequalities in society that impact Latinos particularly. So in our report that we published in the summer, we were the first ones to show that Latinos have disproportionate rates of COVID infection and death in Los Angeles particularly. What we found is that Latinos and Blacks in both LA and New York City, so 2 of the cities that were first impacted, were twice as likely to die of COVID-19 than non-Hispanic whites. So think about this. For Latinos who got COVID-19, they were twice as likely to die as their white counterparts. And the important thing to think about is why is this, right? So why is it that Latinos are getting infected at higher rates, but also dying at higher rates? So for many Latinos, surviving the pandemic boils down to prioritizing work to support their families over protecting their health. Only 16% of Latinos have jobs that permit telework and the safety of sheltering in place. The sobering truth is that over 15 million, or 65% of the Latino workforce, are overrepresented in 9 of the 10 lowest wage jobs considered high contact and essential during the pandemic. So Latinos are working in the front lines of this pandemic, and that's exposing them to the virus at much higher rates than other groups. the high incidence of COVID-19 infections and deaths among Latinos across all age groups are directly correlated with their overrepresentation of frontline work. Besides the health impact, right, another impact is the abnormally high unemployment rates for Latinos that we're seeing. So at the beginning of the pandemic, the Latino jobless rate spiked up to 22% in California. And while some people have returned to work, Latino workers are not guaranteed a job once the pandemic is over because of what we found in another study, which shows that our jobs are being automated. And the automation of the economy has been going on for some time, but the pandemic has accelerated it. Because of social distancing requirements and because people's fear of interacting with others, so with cashiers, for instance, or with other workers, many companies are accelerating the automation of many of the jobs that Latinos do. So we find that over 7.1 million Latinos, so almost, which is almost 40% of the Latino workforce in these 6 states, are at high risk of losing their jobs due to automation. And this is being accelerated by the pandemic. The third thing is that not only are Latinos being particularly impacted, but Latinos are also being excluded from government relief, right? So in another study, we show how undocumented workers, which are predominantly Latino, and their families. So not only the undocumented workers themselves, but if they had any US citizen children or spouses, all of them were excluded from the government relief that most taxpayers in the US received. So all the checks that we all got, right? Like many of us got a $1,200 check sometime in April, maybe May. Undocumented workers didn't get it. And anyone who submits their taxes or files their taxes with something called an ITIN, a tax identification number, or their family members, if one person in the family submitted their taxes through an ITIN, the whole family was not eligible for any of the relief, right? And this happened at the federal level, but then many states did the same thing and excluded undocumented workers who are essential workers for the economy from relief. So what all of this shows is that the Latino community is just structurally disadvantaged. And I'm just showing you here a little bit of some of the pieces, right? Because there's other pieces like housing, right? Where because of the unemployment rates, because of not having relief, a lot of people are gonna, are not able to meet their rent or their mortgage payments, and they're gonna be evicted soon from their job, their housing. And so here's a few policy recommendations, right? So in all of our reports, we always provide policy recommendations. And for the health aspect of it, we really need to be investing more on health for the Latino community, testing in low-income communities of color, expanding access to healthcare and paid sick leave for all the essential workers, increasing access to telehealth for low-income residents and the uninsured. We also need to include all undocumented workers in all forms of relief. And we need to expand our social safety net for everybody, regardless of employment status, regardless of immigration status. The important message also that I want to bring up is that as we start transitioning to our recovery, we need to be very careful and very conscious about making sure that that recovery is equitable. And so not only have we seen that there's structural problems for the Latino community, but so far, any signs of discussions about recovery packages in both the federal and the state legislatures are excluding our communities and our workers. And so as we transition to a recovery, we need to pay special attention at like how are these policies either including or excluding certain groups of people, and how are they affecting the Latino community. And with that, I will leave that for you, and I'm looking forward to the Q&A.
Thank you so much, Rodrigo. I'm going to go ahead and pass it to Yesenia and Elizabeth.
Oh, there I go. Start my video. Hi, everyone. Thank you to the Red Cross for inviting us as panelists. We're super excited to be here. And so we're here to talk about the effects of COVID with the Latinx community and mental health, which currently we are all experiencing trauma with this pandemic. You know, and when I say the word trauma, I want you to have an understanding. It doesn't necessarily mean going to war. It doesn't mean seeing someone get killed. It's much more than that. Trauma in itself is anything that's caused you to feel scared, confused, feelings of uncertainty, which is what we're experiencing right now during these times of COVID, especially in a place where we're having to isolate from the people and family around us. So this is actually trauma in itself, but even more, going back to, we'll see the real effects once the pandemic is over and we all go back to our day-to-day life routine. And that's when we're gonna see the real long-term effects of what we're experiencing right now. So then Liz is gonna go ahead and talk about vicarious trauma for a bit.
So I know, Yesenia, thank you once again to the Red Cross for inviting us. So I just wanted to add a little extra piece on trauma, and I'm going to be speaking on vicarious trauma, especially for our frontline workers, our essential workers. Vicarious trauma is actual exposure to traumatic material. So we're seeing this in our nurses, our therapists, our doctors, our social workers, our grocery, where, you know, people at the grocery store. We're seeing this in our teachers. So this is really important. And, you know, bouncing off of what Yesenia said, we're going to see a lot of this play out once this pandemic is over, the effects of the trauma and vicarious trauma.
So going forward, going back to what Dr. Villegas kind of mentioned, when we think about the Latinx community, there are a lot of structural disadvantages, disparities that the Latinx community is experiencing. And I want to share with you some of the stressors, psychosocial stressors that we're seeing in the families that we're serving. To starting from, you know, having to isolate ourselves, again, going back to our communities, whether it's family members. And when we think about the Latinx community, we think about this concept of familismo, right? Mm-hmm. We're all together, the uncles, the grandparents, the cousins, the second cousins, third cousins. And all those events have had to, there has to be a halt to it because of everything going on for their personal protection and their families. So families are having to isolate themselves more. Also, some of the stressors that our Latinx families are experiencing is their children doing virtual online learning. Mm-hmm. And this affects the whole family in itself, right? Starting from having access to internet, or even schools being able to provide a laptop to some of these children. The access is not there for them. Also, coming from these families, some of these parents have only kindergarten, first grade education. Mm-hmm. So when you think about online learning and then having to support their child at home, it's a lot more difficult for them to be able to support them. When on top of that, there's already other stressors such as immigration status, economic stressors, right now the social political climate right now, deportation, there's so many other things they're stressing about. And on top of that, having to help their children navigate this online system that they're having to deal with now. Another thing that we're seeing within mental health in the Latinx community, there's an increase in domestic violence, and of course also child abuse. Again, when you think back to the children, the safe place was going to school, right? And also because it affects the whole families, these stressors, the prevalence of domestic violence. And just to note, when I say domestic violence, it isn't just physical, but it's also emotional, psychological, financial abuse. These children are also exposed to that, and also abuse, right? Parents are, when you live in a very stressful environment, they only go back to what they know. And sometimes they're reenacting their trauma with their children by hitting them or, you know, being verbally abusive with them. So these are some of the things that we're seeing with these families and the prevalence of DV and domestic violence. Also, the higher incidence of suicide ideation or homicidal ideation, right? Again, we're having to isolate. And with isolating and quarantining ourselves, we're being left with all these feelings, which some of them could be with sadness, anger, and it can lead us to feel really helpless and have those thoughts of hurting ourselves and just stopping the pain. So this is a reality of what our families are experiencing. Also, going back to what Dr. Villegas, a lot of people lost their jobs right now. You know, a lot of businesses have had to close. So, you know, so there is no income. Families having to find food banks to go to, you know, not knowing when they're going to feed their child. These are all stressors that are affecting all of them as a whole, as a family. Also, their undocumented status might be stopping them from going to get help, like social service help, you know, because they don't want anything to come back to them if they were to go ask for help from the government. So this affects them. Also, people are also coping in negative ways, unfortunately, whether it's through alcohol or drugs. This is something that, you know, again, affects the whole family, but there's no other way of knowing how to cope. So they go back to what they know. And sometimes it's intergenerational. It's what they learned from their families, right? And also one thing I wanted to bring up was, again, just the negative coping skills that come out of this. And especially for the families, what affects one parent will affect the whole family system. So it's important to understand that on top of the stresses of COVID, it's the other things that is added to their list that, you know, they need to deal with. And unfortunately, it does come out when we talk about mental health somatically, maybe having headaches, you know, feeling like it's just a bad luck that they're having in this point in life, but it goes back to mental health. And, you know, being able to cope with it, but needing the support of someone that can really help them through this hard time. I'm going to pass it on to Liz, and she's going to talk about the losses during this time.
So a big area that we've been seeing in the area of mental health and where our clients are coming into therapy is the topic of grief and loss. And I'm not just talking, one of the areas is the loss of a loved one, the loss of a family member, loss of a friend, a partner, but loss is also including other factors. So we're talking the loss of family dynamics, gatherings, especially in our Latinx community. We're a very collectivistic culture, right? We, parties, family events, we come together. That's actually one of our strengths, right? The ability to come together. So we're seeing a lot with especially with COVID, the inability to, right? I'm gonna go to my grandmother's house today and just spend some time with her. I have COVID, right? I don't want to get grandma sick. I don't want to be the one responsible to get her sick or something happening. So this high anxiety around being close to each other. We're also seeing the loss of touch. You know, in our community, touch is so important, right? So healing. It's one of the biggest ways we show love to our loved ones. And right now, there's this high anxiety of even touching one another, hugs, right? Hand holding, kisses, which is a big part of, you know, of even our social gatherings. And now we're not able to really do that because of that fear of, I don't want to get anybody sick. Also, another thing is religion and spirituality, right? So a lot of our, you know, unfortunately, we are seeing some of our, you know, churches having outdoor gatherings, but not all. So, and then in our Latinx community, we know how big religion is. It's one of the things that gives us hope, right? Gives us hope for the future, something that a lot of our clients use as a coping skill, prayer. You know, something to kind of look forward to. So we're seeing that right now. Going back to actually the loss of our loved ones. even the way we're grieving our loved ones right now, the ceremonies look very different now, right? If we are to have one at a cemetery, the seating arrangement is very different. Can we even go hug our loved ones, right? For comfort, for support. So that area is looking very different for our community right now. We are seeing at this time, like Yesenia mentioned before, a lot of the virtual learning. So that also means a loss of privacy, not only for our children, but it's also for our parents, our grandparents, right? Where sometimes people would go in and go to their room just to have some time for themselves to unwind. Maybe our child is in there working on their homework and having class. So not much space, especially especially for homes that maybe we're living with a lot of family members, right? So that's been making it very difficult for our community. Right now, one of the things that we were noticing is a lot of our clients, especially in our Latinx, they're staying on with mental health therapeutic services. So that's a beautiful thing. We're also getting a lot of clients, new clients wanting to start services because of the pandemic. So we're also noticing an increase in wait lists, not only in a private practice setting, but in community mental health, nonprofits. So we have clients waiting and struggling. So that's where, going off of Yesenia, suicide rates are going up, homicidal rates, addiction of all types, substance abuse, eating disorders. We're seeing it increase, so it's overwhelming. So, I'm glad that a lot of our panelists will be giving some resources to our community, but we're noticing that as well, the loss of healthcare, right? There's a lot going on right now, fear of what's going to happen, loss of healthcare, loss of jobs, meaning loss of housing, loss of even cars, loss of so many things that maybe weren't something we were always thinking about. Now it's very much in the forefront. And for our children, adding a little bit onto what my colleague Yesenia said, our children are losing the loss of friendships, loss of connection with them. Where at school, that was their safe place, where they got to bond with their friends, they got to bond with their mentors or teachers. They don't have that as much now. And we're seeing that that's really affecting high anxiety rates in our children, depression rates, kind of always just being on the screen, not being able to, hey, let's go play ball outside, right? Just now we're just kind of on a computer. So we're seeing loss in different areas. And going back to the loss of housing, we're seeing homelessness in our community going up as well. So different areas that we're seeing grief and loss in our community, which is really important for us to kind of, be able to educate.
Yeah.
Did you want to add anything?
Yeah, and just in general, I want to go back to some of the points when we talk about access to mental health. I think one of the main components of it is just the stigma from the community. And it could be stigma of like, I'm not crazy, yo no estoy loco, to be going to someone to talk about my problems, right? And that's when, in turn, they would use the spirituality, religious leaders to help them in that state. But there's a stigma against mental health in the Latinx community. Again, lack of insurance, adequate insurance, providing, a mental health component of their policy, or being undocumented and not having access. And just in my working with the immigrant community, a lot of them are scared to even get Medi-Cal, to get services, because they don't want a repercussion to come back for them in the future by getting this resource. Also language, there, like Elizabeth mentioned earlier, there is a shortage in mental health professionals that are trained in treating trauma. And it's particular with the Latinx community, because it is a specialty, because again, going back to the familismo, they don't trust just anybody. You're becoming part of their family when you're accepting a client into treatment. So it's a lack of also language, and also a lack of culturally tailored services for the community. Again, going back to, really personalizing that session with the client. and also difficulties of recognizing the emerging signs of mental health. Again, these are the families, sometimes the parents I would hear, well, I'm starting to get dolores de cabeza, alguien me está haciendo brujería, todo está matando mal, so on and so forth. Yeah. And so, you know, and the thing about it is that sometimes rather than, you know, maybe I need to go to therapy, it's like, I'm going to go to my doctor and find some kind of medical rule out for their symptom, when it could be really related to mental health. And again, it goes back to also problems identifying what psychiatric symptoms look like. And again, just the lack of therapists out there trained to really service this community that is in big need with what's going on right now during COVID, because in these times, we are all feeling the effects of this pandemic, but even more our Latinx communities that have other disparities. And when we talk about intergenerational trauma, this just adds to the list that affects their mental health.
I want to add, I know Yesenia mentioned a lot of just therapeutic services and this fear. We're also talking about immigration evaluations, which is something that a lot of, there's a lot of fear in getting one, right? What will be the consequences of me going and getting one of this? And right now, we're limited. A lot of it is virtual, and a lot of our Latinx community might not have, right, maybe a working phone, might not have a working laptop, and might be too fearful to come into our office due to fear of, giving a therapist COVID or contracting it. So being mindful of that too, that even the immigration evaluation component of it is kind of where we're seeing that they're struggling, especially with the climate of, currently political climate. This is really affecting them, another stressor on top of everything else that's going on.
Right. So, but yeah, and going forward, I think one of the biggest things that, in helping the community and all of us being part of the panel and doing our personal work with the community, is one of the biggest things is that we can do for them is to, aside from wearing our professional hat, whether it's, research, whether it's language, whether it's therapists, I think we're also in the field of social service, where we're giving our clients referrals, not just for mental health, but hey, I know McCord, you need to go to the doctor, go get, what if it's ruling out the medical, and getting them those resources to help guide our clients there. And I think that's one of the pivotal things that we can do in helping the Latinx community together as a community when it comes to everything that we're experiencing right now. All right.
Thank you. Yes. Thank you so much. We're really grateful to have been able to share some of our kind of knowledge, and we're also looking forward to any questions after the presentation.
Thank you.
Bye.
Okay. Thank you so much. Yesenia and Elizabeth, we'll go ahead and welcome Lucia Torres.
Hi. Hello, everyone. So thank you both, Patty and Kendall, for having me here, and also Dr. Villegas and Elizabeth and Yesenia for all of that really great information. My name is Lucia Torres. I'm the Executive Director of Las Fotos project, and I'm actually going to set up my share screen here for a second so that I can show you all a little bit of what I'm going to talk here. Here we go. So I just wanted to go through and share a little bit about who we are and talk a little bit about the community that we've created sort of before this pandemic has happened, in order to share a little bit of best practices that we've learned as an organization to support our students and our young women in our communities. So Las Fotos Project is a community-based organization who mentors teenage girls through photography. And our mission is to elevate the voices of teenage girls from communities of color, to empower them to uplift themselves and their communities, and also to just gain some experience for their future careers as well. And actually, I do have a really brief video. I'm hoping that the sound does come through as well. Patty and Kendall, you can let me know if it doesn't. But I wanted to show you this video about the organization to give you all a sense as to the community that was created and sort of interrupted during this pandemic, which is what many organizations across Los Angeles have also experienced. Oh, before I get to the video, so this is just a little bit about our impact. We serve annually about 150 girls through our direct programs and over 300 girls through our community engagement programs. We have, since 2010, roughly provided over $250,000 worth of arts education to our students for free. All of our arts programming is completely free to all the students who participate in our organization. We provide them with everything that they need, a camera, all the technology. We provide them with the space, the mentorship. All of it is, you know, completely free of cost to our students. And so since 2010, which is when we were founded, we've provided these services to over 1,400 girls, along with over 6,200 hours of free photography instruction and over 22,000 hours of mentorship instruction from professional professional photographers who mentor with us throughout the year. And so, you know, this year we're celebrating our 10th anniversary, and everything that's happened in 2020 has really been momentous, for lack of a better word, just because it had us really as an organization and as a community reevaluating the work that we're doing, reevaluating the impact that we have, especially on young women and the young women that we work with. And also reevaluating, you know, how we're going to move forward after this. You know, as Dr. Villegas and Elizabeth and Yesenia both mentioned, you know, the community is undergoing a lot of trauma. And anything that we have experienced as a Latino community before, we're experiencing it at a magnified level now. And so just thinking about like, how do we move forward as a community, and how do we move forward as people who are going to support our youth and everyone in our community, right? So here's a brief video that I'll share with you all. And then I'll, like I mentioned, I'll go into talking a little bit about some of the best practices that we've learned. Okay, so I'm told I can't hear the video. I apologize for that. I can share the link to this video so you all can take a look at it afterwards. Technical difficulties, of course, that's another reality of everyone's life these days, right? So I'll share this video with you all, and you all will feel free to watch it whenever you have a moment. But the reason why I wanted to kind of share the video and talk a little bit about, or, you know, just have you hear a little bit about what our students were talking about and their experiences at Las Fotos Project is because Las Fotos Project was really created as a space initially where girls can come together and express themselves and feel like they had a safe space to be able to just explore their identities, explore their communities, and really talk about things that they themselves were experiencing as a unique experience of being a teenage girl. And these spaces are far and few between, right? What we found over the 10 years is that in this space, we have been able to create a community with our students and with our mentors where our students are really able to just break away from a lot of the pressures that they're feeling from media, both in terms of stereotypes about Latina women, pressures about just being women in general, how they need to look, how they need to feel, how they need to express themselves, right? And also, you know, to be able to really process what they were feeling in terms of, you know, living as a Latina teenager now, and you know, in our teenage years between 13 and 18, you know, if, you know, your teenagers watching, you know, if you're, you know, or you can remember yourselves, your identity is constantly evolving and constantly shifting. So a lot of what Elizabeth and Yesenia were talking about in terms of like what our Latino community are experiencing now has very much been experienced, like I said before, by our young women, you know, in the community in general. And so being able to provide a space like Les Fotos Project or any real other community-based space is really vital to the community for them to be able to decompress, to share their knowledge, to build a community, to build those healthy networks and connections, right? And so we do that, I'll go through this really quickly too. We do that through 3 of our core programs. So one of our core programs is called Esta Soy Yo. And so Esta Soy Yo really focuses on using an individual voice for self-expression and looking at yourself through the lens of a camera. You know, I think a lot right now, like the selfie is something that we think about often, right? That you pick up your phone and you take a selfie and you post that to Instagram. But there's actually something very, very powerful about a self-portrait. Especially when you are taking a very vulnerable self-portrait and a self-portrait that really expresses who you are as a person outside of the scope of media, right? So these are 2 examples of portraits that were actually taken during our spring semester after the stay-at-home orders were in place. And so our students were really processing what they were experiencing and really processing, you know, just what they were feeling because of COVID, the lockdowns, a lot of like what Yesenia and Elizabeth mentioned as well in terms of family dynamics. And so being able to capture a self-portrait outside of this concept of a selfie, again, is a very, very powerful tool. And so our Esta Soy Yo program utilizes that tool for our students to be able to do that and reflect about who they are in their current time as young women, right? And our other program is called Digital Promotoras. And so our Digital Promotoras program was really established as a way for our students to explore their community and get closer to their community. It's another way of civic engagement and community engagement, right? Typically, we think about civic engagement as students, you know, participating in the civic process, either like voting or going to City Hall or, you know, even doing something as simple as community cleanups. But participating in a civic process and participating in community engagement efforts can also be taking the role of a storyteller. And so our Digital Promotoras program does that with our students. We teach them different photojournalism techniques and documentary techniques so that they're able to document the community. And so prior to COVID-19, our students were connecting with local community organizations, documenting the work that they were doing. They were connecting with local leaders and sharing their stories about the work they were doing in the community. And since the pandemic and COVID, and especially with a lot of the social, you know, uprising that has been happening, the anti-racist movement that's you know happening, the voting process, you know, there's just so much that's been going on in our young people's lives right now. That our Digital Promotora students and all of our students really are now taking the camera as a way to document their experiences in community during this time, right? And so this is actually a photograph from one of the Black Lives Matter protests that our student happened to be attending. And so she utilized these skills to document her experience during one of these rallies that she participated in. This one, a little bit of a brag moment. This particular student had her photo, and just actually to show the power of photography, had her photo as part of the Washington Post spread on, you know, how young people were engaging with their community during COVID-19. And so for an experience like that, this young woman who is 14, 15 years old, to be able to say that she already had a photo in the Washington press is like amazing, right? And especially during a time where, you know, she's experiencing isolation, she may be experiencing some anxiety and depression, a little bit of fear, you know, but out of that, you know, comes this really magical moment for her. And these are a couple of others that were taken again during the pandemic. You know, again, our students documenting their communities, documenting their families as they're going out and just seeing what's happening with everyone, right? And then our other program that we have that has also actually been really instrumental to our students this time around is our Creative Entrepreneurship Opportunities Program. We call it CIELO for short. And so in this program, our students prior to the pandemic were being hired as event photographers to go out and take photographs of events or family portraits, like the photo that's here is a student doing some headshots, some professional headshots. And so, you know, when the pandemic hit, you know, of course, there's no more events, people aren't close. And so our students sort of lost these opportunities to connect with people in order to be able to, you know, just gain experience as professional photographers. And that was, you know, a little bit of an impact for our students as well, because they were all earning an income. So back to what Dr. Villegas was talking about, you know, the Latino community experiencing a lot of sensitivity and just kind of perilousness in economic equity and job, you know, sustainability is something that we as an organization also take into account a lot as well, because, you know, our students tend to think about like their future careers being something along the traditional route as being a teacher or a lawyer or a doctor, or they'll go into the sort of labor force, you know? And so through our CIELO program, we're trying to expose our students to a different career path, and that's a career path in the creative economy. And so what has actually happened out of what's currently going on now during COVID-19 is that we are now experiencing a rise of people finding an interest in wanting to get their products and their businesses online. So a lot of e-commerce photography. And for us, that opened up a whole new avenue in terms of like, how do we connect our students to these new opportunities that are now emerging, and what an opportune time for them as well, that, you know, everyone is sort of in this newness of what does it mean to be, to have our businesses online, to take our, you know, our professional lives and our business online. And so here we have our 16, 17, 18-year-old students really at the cusp of this and really embracing it and you know, really starting to look to see what their future can look like beyond doing just event photography. And so these are a few examples from our CIELO class. The Golden Globe ones did not happen during the COVID-19. The other one of the young woman in the jumpsuit, the yellow jumpsuit, that is actually a photograph that was taken as part of a sort of social distance product photography pilot that we did with a company called Girlfriend Collective, make sustainable workout clothing and things like that. And so that was a really great experience for our students to be able to get out and continue their workforce development skills, their work development training through this program, right? And so all of this that we do is modeled under what we call participatory photography. And this is actually, if you're familiar with photography, you might be familiar with this motto. And so participatory photography is a modality that asks participants to analyze their personal and social landscapes through the lens of photography. And this, so this process of self-exploration is designed to validate and empower our students' experiences. And so without really knowing as an organization, building ourselves up and building our programs around this modality, we were able to kind of establish a model that really supported our students in this new era of COVID-19 pandemic, and to be able to really build a foundation for our students to continue to engage in something the way that they used to, probably just a little bit different, right? And so these are just a few examples of our students, some of the work that they did and the classes that they had. Again, the community that they were able to create, their mentors, each other prior to the pandemic, some of the experiences that they were able to have before that. And so, like I mentioned, the pandemic really, for us, brought all of this to a halt, right? We were able to meet in person. Students were passing around their cameras. Mentors were along with them, side by side, taking photographs. They were learning and growing with each other. The Las Fotos project as a space became a space where a lot of our students were able to come after school and decompress. They left behind everything that was happening at school. They met with other young women who were not part of their social circles at school, so their networks were expanding and, you know, their friendships were being created. And then, you know, COVID-19 happened, and we just had to kind of stop, and that happened. And so we really, as an organization, like I said, had to take a step back and look at what we were doing, and look at the models that we were employing in order to support our students, to see, well, how can we utilize what we were already doing, what we know, and what we know from our students, in order to continue supporting our students, right? So these are some of the takeaways, and so these are some of the things that we were able to do as an organization, and for us, some of our lessons learned, right? First of all, we always incorporated therapeutic photography in our programming. We always incorporated wellness in our curriculum, ensuring that our students had an outlet for themselves and to express themselves, but also to really just, connect with their mental wellness. And you've already heard, Yesenia and Elizabeth share a lot of, what's affecting our communities currently. And just us knowing as an organization that this was something that we were already seeing come in through the doors, right? So just a little facts to kind of put this in perspective. Anxiety disorders affect 25.1% of children between the ages of 13 and 18 years old. And so research shows that untreated children with anxiety disorders are at higher risk to perform poorly in school and miss out on important social experiences. So that's one thing. And then the next, just to kind of put this into perspective as well, is this fact that in 2017, close to half of all Black girls are consistently sad or hopeless. And we're unable to engage in some usual life activities. So you imagine that this is something that our people are already experiencing prior to the pandemic, prior to having to stay at home, prior to schools being shut down. And now after this, all of this being compacted, right? And how this just really affected our students' mental well-being, how the loss of jobs from their families, their parents also affected them as well. Of course, how that is down and that stress is passed down to individuals too. How the passing of family members, the passing of neighbors, the constant news, the constant uncertainty, of course, all of that just compacted. And so we knew that this was happening. We knew that this was going on. We heard it from our students, we heard it from our families, we heard it from our neighbors, right? And so one of the things that we knew that worked and that always worked before was that art as an outlet and art as something that people can lean on works, right? It's something that people can embrace, and it's something that really can help them open up, right? So we thought, well, we can't just come to a halt. We have to keep going. And so this is actually from a study in the United Kingdom that is currently actually being done in real time. And so this is some information that I pulled from there. And what they found is that people who have spent 30 minutes or more each day during the pandemic in art activity, like reading for leisure, music, etc., have felt lower rates of depression and anxiety. So again, we know it works, right? And so what we decided to do between weeks 1 and 3 after the stay-at-home order in place, we said, okay, first and foremost, we have to stop. We have to stop and take inventory of where we are and where our students are. So what we did is we surveyed each and every one of our students, and there were a lot of students, but we surveyed each and every one of their students. We gave them all a phone call, split it up between our volunteers and our staff members, and we called them up and we just simply asked, how are you doing? How are things going? What do you need, right? And so after these phone calls and these surveys, we found that a lot of our students and our families were immediately, and this wasn't just like a residual effect, families were feeling it immediately. The effects of losing their jobs, of not having enough income to pay for the next, grocery run, to pay for rent. And as Dr. Villegas mentioned as well, a lot of our students, because their families were maybe, potentially undocumented, did not qualify for a lot of the assistance that was out there. And this also actually extends to even public assistance that's part of some organizations, because if organizations are publicly funded, they're federally funded, there are still some qualifiers that may need to be had for families in order to get that assistance from organizations as well. And so we knew this, and we were hearing this from our students. So we shifted our focus from programming at that time to rapid response, trying to get together resources for our students, connecting them to mental health resources, connecting them to housing resources through our partners. We also reached out to our own partners and individual donors and said, this is where we're at, and this is where our students are at, and these are the supports that we need. And again, thanks to the community that was built around us, we were able to raise enough funds in order to provide our more needy families with stipends so that they can get some groceries into the refrigerators, pay a portion of their rent, just sort of keep afloat a little bit. because it doesn't make sense, or at least for us, it didn't make sense to continue doing the work that we were doing as if nothing was happening, right? Because that was not going to be supportive of our students. So we needed to make sure that they had at least a little bit of a solid ground to stand on before they could continue going. And so those were our lessons in weeks 1 through 3 after that shutdown. And so these are, again, some images taken by our students during this time. And so in the following weeks after that, and what we're continuing to do now, some of the best practices that we've learned and some of the ways that we've learned that really have supported and support us and supporting our students is integrating mindfulness activities into all of our lessons. And so in addition to the photography that our students are taking, we also ask our students to, journal, to share down their thoughts, to share their thoughts about a particular photograph that they took, if it was, something that they were really reflecting on at that time. And we also provide a safe and open space for students to share. So we've told all of our teaching artists and our volunteers as well, it's okay if students show up to the classroom just feeling a little bit off. And if students need to just kind of like shake it off and decompress, that's okay. We need to leave that space for them to be able to do that. And so that really helped to bring our students together and back into community space, because they knew that it wasn't going to be jumping from one class to another class online, that they were going to be going into supportive community. They were going to be talking to each other. They were going to be sharing exactly what they were feeling. And using those conversations as a mechanism to really inspire their photography and what they wanted to do during this time. And so the other thing that we learned that really helped and that we heard from our students was the increased communication from our staff and our mentors. So we did continual check-ins with our students, again, just calling them. Sometimes they were just 5-minute phone calls like, hey, hey, Cynthia, how's it going? How are you doing? Are you okay? Yes, things are okay. Okay, great. I'm gonna see you on class later or something like that, just really small, quick check-ins for the students really helped. We heard from our students that those check-ins were really helpful for them to just know that other people were reaching out and to know that there were other people outside of their, homes and their immediate areas that like were thinking about them and connecting with them. The other thing that we did that we found has really been very supportive is we actually opened up our social media platforms to our students. Our programs and everything have always been student-led. We've always looked to our students to provide direction in the way that our programming is happening. But really being able to turn over these platforms to our students has also given them an avenue and a venue to really share what their thoughts are. And so we've increased our community engagement activities, and our students actually lead now things that we call like girl talks, in focus talks, where they are taking the platform and just leading conversations on anything they want to talk about. So their own mental health, how do you practice self-care, what is it like to be a first-time voter? And so being able to, again, like provide the space to share out and like how my mom always tells me, desahogarte, right? Like just release and let go and share out has also been really helpful to accompany the photography programming that we're providing for our students. Last thing that we had too is really leaning into youth. I think sometimes as adults, especially as professional adults, we have to know the answers. We have to have it together. We have to know the best practices. The truth of the matter is that, or at least, me speaking for myself and my staff, we aren't teenagers, we're not living this life as teenagers. We're not going through these emotions as teenagers. We're not experiencing the trauma and the depression as teenagers. And so the best people to tell us how to deal with this and how to move forward and how to support our students. And so really leading to our students so that they're the ones that are guiding us. They're the ones telling us these are the supports that we need, and this is the direction that we need to go in, has really helped us as an organization to be able to build out and stay as active as we've been able to stay, and to keep our students engaged as well. And so these are just a few takeaways from our students who shared with us their experiences after participating in our online programs, during the lockdown. These are from our spring class, and we currently have a fall class happening right now. And so just to share a little bit about this. So for example, the student said, this class offered me a great de-stressing outlet during quarantine. The curriculum helped me develop important skills and kept me excited each week. I was stressed while I was stressing about homework and personal responsibilities every day. So photography was an amazing gateway to express myself and let my creative brain free. And here's another one. A student said it was an interesting change doing classes online, but it felt like it helped us bond close together. I enjoy being able to step away from all the stress and fear in the world right now and come together and just share images and talk to people. And finally, this one is a little longer. And so the student shared, at first it was hard and a little challenging, but after a few classes, it became something I looked forward to and enjoyed. It was a little harder to learn about camera setting and technical things like that, again, because, you know, those are manual things that they typically learned. Overall, I had fun while I was in class, being able to connect and talk to people who understand what I'm going through at the times. It also kept me busy and allowed me to have time for myself. And so, you know, this information and this feedback that we received from our students in the spring let us know that we were on the right track. And so we wanted to continue doing that. And so again, like I mentioned, we are leaning heavily on our students. Our youth advisory committee, who is made up of 12 active and alumni students, are the ones who are helping guide us in all these other supplemental programming and activities that we have going on that are keeping our students engaged and our parents engaged, as well as our community. So that's what I wanted to share with you all. Just again, just a little bit about what we do and some of our takeaways. You feel free to connect with the work and connect with what our students are doing on Instagram at Las Fotos Project, and I'm sure that'll be shared in the chat as well. And then our website always has updated information about what's happening next and how you can engage with our work and engage with our students' work as well.
Thank you so much, Lucia. We really do appreciate you sharing your time and sharing what you do. It seems like amazing work. But we'll go ahead and move on. One quick thing before we actually move forward. If you have any questions that you may have for any of the panelists, go ahead and use that function below. It says Q&A, and we will get to that shortly. The next up, we do have Luis Resendiz that will be speaking to us. So go ahead, Luis.
All right. Hi, everyone. Well, thank you for the invitation, and thank you for hosting this space. Like Patty said, my name is Luis Lopez Resendiz. I do want to mention that I am part of the Comunidades, Indígenas and Liderazgo, or Indigenous Communities for Leadership in English. We are located here in South Central Los Angeles. We are a nonprofit organization that is composed by Indigenous migrants. We work with Indigenous migrant communities. I am myself, I direct the Indigenous Interpreters Program. We have a network of around 250 Indigenous interpreters across the country. And we make sure to, provide interpretation on Indigenous languages wherever it's needed. It could be at a detention center, at a school, at a federal or state court, or anywhere else where it's needed. I myself, I am part of the New Savvy community. When my parents immigrated to this country, they only spoke their native tongue. So doing this work, as an Indigenous migrant, it is important. I just want to share a little bit of the work that we do. And this month, the topic of this conversation centering the Latinx community, sometimes there is this idea that everyone that comes from Mexico or any other country, Guatemala, for example, there's this idea or belief that we all speak Spanish, right? Like I said, when my parents immigrated here, they only did it speaking their native tongue to Unsabi. And not everyone speaks Spanish, right? Not everyone is, we don't call ourselves Latinx or Latinos because it is important to visibilize the migration of our communities. So I am a mixed tech. In Los Angeles, there is a vast majority of Indigenous migrants who are not taken into considerations in the creation of resources that are allocated to Indigenous migrants. I want to share the website from our organization so that you can see what is it, who we are. So this is our community. We have different programs that it can be facilitated to all of y'all. make sure to, you know, reach out to us and book us for if you want to learn about indigenous communities. We have a cultural awareness training that is done, that we provide to different institutions. For example, the Los Angeles Police Department, that we do cultural awareness programs for them 4 times a year, where they are learning about the migration of indigenous peoples to the city of Los Angeles, who they are, and what do they do, you know, so that they can better serve the communities that, you know, they patrol, and to provide an interpreter. You know, if you follow the news, you've heard that LAPD got a card where they can ask an indigenous migrant what language they speak, and it's in English phonetics. For example, if they encounter a Zapotec person, a Zapotec speaker in South Central Los Angeles, they ask him, "Do you speak Zapotec?" You know, so in a way to, if they answer yes, you know, and if they have problem communicating with that person, they reach out to us and we provide an interpreter. Make sure to follow, you know, the work that we do. It is important for us to visibilize indigenous migrants, because, you know, Mexico and Guatemala are really diverse countries. So that also talks about, you know, that not all of us speak Spanish, not all of us are identified, or we don't identify as Latinx, Hispanic, or even Mexican. When my parents immigrated to the US, it was shocking for them to see that, you know, they were now recognized as Mexicans in a country that was not Mexico. Because in Mexico, indigenous communities are seen as, you know, second-class citizens that don't deserve the national identity. So it is hard to thrive. And now with this being said, I ask you to imagine, you know, if the Latino communities have struggled a lot during this pandemic. Now imagine being an indigenous migrant that only speaks their native language, coming to the United States, facing a pandemic, and not knowing where to get resources. You know, so therefore we do provide these programs where we talk about indigenous migrants. Feel free to check out our website. It's CIELO, mycielo.org. So y'all can see the work that we do. During this pandemic, we started with the with the fund for undocumented indigenous immigrants, and I will share you a video of the work that we've been doing. Let me see. Oh, I can't. Oh, I closed it. Hold on. I accidentally closed the video. All right. Let me know if you have problems hearing. So this talks a little bit about the work that we have been doing with the undocumented indigenous program, in which we provide funding for an economic relief for indigenous migrants.
Hi, Luis. Unfortunately, we cannot hear the video, the audio.
Pardon me?
We can't hear the audio for some reason.
Kendra, are you able to play it from? No?
No, I think the Zoom doesn't pick up audio on any computer. So sorry about that. But we'll share the link with everybody.
Okay.
Yeah.
Well, I can play it, and it still has subtitles.
Yeah.
So y'all can, if you're able to
read along.
what is, yeah. So that was a video that was created on the Undocumented Indigenous Fund. Like I think Rodrigo mentioned in earlier that a lot of the workers who are undocumented didn't receive a stimulus fund, um, and and now also also indigenous migrant communities were beneficial. They didn't receive a stimulus fund. But now imagine when the resources were created for Latino migrants in response to the pandemic. Um, Many of the indigenous migrants came to our office asking for these funds, knowing that they didn't qualify for other funding because they didn't know how to understand Spanish really well or English. So there has the pandemic has shown us that before the pandemic there was a lack of resources that were allocated for indigenous communities. So when the pandemic hit, we have seen that indigenous migrants were the most affected. Therefore, we started creating resources for them. We created videos on COVID-19 on indigenous languages so that we can share it with the communities that speak those languages so they can, better take care of themselves. And we also started a map, which I'm gonna share a sneak peek. This is not public yet. This map is being created with CIELO and other allies that work with at UCLA. And this is a density map that talks about the indigenous populations in Los Angeles. This is only a map for 2,000 immigrants. This map will grow eventually, but these are the languages that are spoken in different areas of Los Angeles City. So you can see that there's this is just a picture. I can't share the entire map yet because it's not public, and it will be public on November 20th. So stay in the lookout for the news. Follow us on social media because we're gonna have a press conference where we're gonna talk about, the indigenous migrants that are not getting resources, or people are not taking in consideration when it comes to, providing support to the communities. And you can see that, around the downtown, the communities around downtown are the most heavily populated communities with indigenous migrants, with a lot of people speak an indigenous language that is not, is different to Spanish or English. So make sure to, follow us, support indigenous organizations, be inclusive of them. Sometimes we do face a lot of discrimination and racism from our fellow Latinx immigrants because of the way we look. There's this idea that, an indigenous person is not educated enough to be in this country, to share their stories. So therefore we have other people that are not necessarily indigenous speaking on the experiences of indigenous migrants. So I do recommend, following the work of indigenous organizations because it is important. It is important. We just celebrated 2 years ago the 528 years of Indigenous Peoples Day, Indigenous Peoples Resistance. We are still here. A lot of us are doing the work to provide services to many indigenous migrants because there's no other space that is providing these services. There's no other place for indigenous migrants to go and ask for resources or there's no other communities allocating these resources for them. So therefore, I do recommend people to follow the indigenous migrants and follow our language, our programs. I just want to share that before the pandemic, we had we still have the conference, but now it's virtually. This is an Indigenous Interpreters conference that is hosted here in Los Angeles, and these are Indigenous interpreters that come from different parts of the country to be trained on how to interpret from English from an indigenous language to Spanish to English, or those who are trilingual. So there's a 2-day conference that happens. Now we do it virtually, and we have indigenous interpreters or indigenous speakers from different communities, from Guatemala and from Mexico, come and speak, because those are countries that are really diverse in language and we need to provide those interpreters. So this is the project that I organize, so I'm the director of. I'm in charge of, sending the interpreters across the country in places where they are needed. Most of them are, in detention centers, facing a family separation, deportations, and things like that. We have resources on indigenous languages. Oh, these are just the videos of different videos done in indigenous languages. And we also have what is the Indigenous Literature Conference. As indigenous peoples, we are also producers of creators of literature. So this literature will, hopefully by next year, if the pandemic is over, we'll be able to host it again at the Central Library of Los Angeles, where we have an indigenous literature conference where, indigenous writers come and share their writings, their poetry, their stories, and everything they produce. So we have people come and listen to the literature, and we also have an indigenous rap concert. Because music is also something that involves. You see Superman there. If you're familiar with Superman, he's a Native American rapper who writes and sings in his language, and he does a lot of work. So we try to bring people from different parts of Mexico, Guatemala, and the US to talk about or to sing with us. So this is our Weaving Words and Rhymes, concert, which is an indigenous rap concert. Yeah, so make sure to follow. This is our team. This is the CIELO was founded and created by women. So this is an indigenous women-led organization. Janet and Rodrigo were the co-founders, and so this is our team. So make sure to follow our social media. I think we have the social media in our team was featured in Vogue. So also try to see, and this is what I was trying to share. Why it is important that we do this work with the LAPD, and we do the work on trying to the cultural awareness program with the LAPD after the shooting that ended up taking the life of a man who was an indigenous man from Guatemala that was shot and killed. So let me see if there's a picture of the cards that they have. No, but this was on the LA Times, so make sure to follow them. And this is the type of the work that we do. So please, on Indigenous Peoples, we like to call October Indigenous Peoples Month because we need to acknowledge that there's also indigenous communities here in Los Angeles and that we are migrating. We sort of have a map of all the migration of indigenous migrants. So it would be nice if, people have questions to reach out to us to encourage, reaching out to indigenous communities, because we are here in Los Angeles and many of you all serve or work around communities where there's a lot of indigenous migrants. So it's important to produce materials and resources for them and contribute to the visibilization of indigenous migrants, because like I said, not all of us are Latino or Spanish speakers, and many of us still speak our mother tongue. It is important to acknowledge that in order to contribute, to the protection of communities that have resisted and have survived for 528 years of genocide. We call it our resistance, and we are here in Los Angeles and elsewhere in the country. So make sure to reach out. And if you want a cultural awareness for your organization, please do reach out to us, because those are important. We recommend organizations to be aware of the migration patterns of different communities across the U.S.-Mexican border. Thank you.
All right, thank you so much, Luis. We appreciate you talking to us about this. It's very important, and we're just so happy to have you today. And thank you to the rest of the panelists as well. We really do appreciate you taking time out of your day to talk to us. And then one thing that I would like to share with you all is just to talk to you very briefly about this program that we have, a part of the American Red Cross. As you guys know, our mission is to really support people, especially during times of disaster. And so one thing that we realized is that a lot of the times the Latino community, you know, just needed extra resources, and also there was a barrier between us. And so we wanted the Latino community to really trust us, especially in times of disaster, right? There's just very many different scenarios that come into play, but we decided to build on that. And so we have a program for volunteers to join, and it's called the Latino Engagement Team, which is also known as LET. It's an amazing program that I am fortunate enough to be a part of. And so our main mission is that during times of disaster, we are deployed to wherever we are needed. And our goal is to reach out to the Latino community and offer our services to them and really gain a trust with them and letting them know that we are not a government agency. We are a nonprofit, and I think sometimes people do forget that, and we completely understand that. So part of our goal is just to involve them with the Red Cross and just always inform them of our services, because during times of need and disaster, we do have many things that we offer completely free. And we have so many resources, especially during that dire time. And so like Kendall had mentioned, I actually have gone to 2 deployments. So 2 different regions to support. One was in Northern California, and my most recent was in Oregon. And so there, for example, in Oregon, a lot of Latinos didn't know what the Red Cross was or what services we had to offer. And so fortunate enough, we were able to go out to the community, talk to them about what the Red Cross is. So we would reach out to different faith partners. We would reach out to other nonprofits. Since there's a lot of migrant workers, we reached out to a lot of migrant organizations and, you know, joined efforts and got to a lot more people than we would. And it was an amazing experience because many people in the area that I was in Oregon completely lost their homes. They have nothing to go back to. So it was great to be able to offer them a lot of support. And it was also amazing to hear them say that they were so appreciative of what the Red Cross had to offer. And so I am a very proud Red Crosser, and I'm a very proud Latina. So to me, this is a very special program that we have. So if you are ever interested in learning about it, you can reach out to our main coordinator, his name is Pedro Carrera, and we will include his email. And if you are not yet a Red Cross volunteer, you can go ahead and sign up at our Volunteer Connection account. It's very simple. And of course, if you ever have any questions regarding American Red Cross, volunteer opportunities, or just Latino engagement team, you can also contact us. So we're going to go ahead and open up our Q&A. So if you have any questions to any of our panelists, including myself, you can go ahead and do that now. And I will go ahead and take a look for us. Okay. So we don't have any questions quite yet. Okay. So we'll go ahead and move forward. No worries there. Again, if at any point you have any questions on anything relating to our panelists, you are more than welcome to let us know. We will be sending out an email after this with all the information that our panelists shared with us. And we will have another session such as today, but we will be having it in Spanish. And it is going to be our first Spanish community conversations. So we're very, very excited about that. So if you know of anybody that would be interested, please go ahead and share that. And in the month of November, we are going to have another community conversation. And that one is creating a welcoming and safe community for trans and binary people. And that one will also be held in English and Spanish. And so another thing that we ask of you is we will be sending up a follow-up survey. Please let us know how we are doing. We really want to continue these efforts and make this a lot better and welcoming to all of you. And also those who do respond to our survey will receive a free Red Cross branded mask. As we know, those are very useful right now. So all you have to do is answer the survey for us. But again, I want to thank all the panelists for supporting us and our communications team here at the Red Cross for helping us in making this effort happen. So thank you so much, and I hope you have a great rest of your day to all of you.